Your Dog's Friend is a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. We promote positive method of training and behavior modification through stress-free methods. As part of that mission, we offer free webinars like the one you're about to watch. Subjects range from dog behavior, stress-free training, and other tools to help you understand your relationship with your dog. If you like the webinar, be sure to give us a thumbs up. Click the notification bell and subscribe to our channel. By subscribing, you'll be notified when future videos are posted. Now enjoy the webinar.
So welcome to today's webinar. It's Dynamic Dog Assessments. Could pain be behind your dog's behavior? This is sponsored by Your Dog's Friend, a nonprofit 501c3 whose mission is to help keep dogs out of shelters by educating and supporting their humans. My name is Carrie Hoare. I'm a volunteer with Your Dog's Friend, and I'll be your host for today's webinar. Our speaker today is Kat Heckert. Kat became interested in behavior and training when she entered the animal shelter world. In 2020, she decided to transition to working privately with people and their dogs. She is an accredited professional canine behavior consultant, certified with the Karen Pryor Academy and Fear Free organizations, and a dynamic dog practitioner. She offers private training through JW Training and Behavior. So let's get started. Over to you, Kat.
Hi, everyone. Thanks so much for joining me today to talk about pain and behavior. This is one of my favorite topics to talk about, so I'm really excited to be here today. So we're going to jump right in. First, we want to talk about what kind of pain are we going to be discussing today, right? There are different types of pain. So there's acute pain, that's shorter lasting pain. It goes away when it's treated. So if you break your arm, even just get a cut, that's pain with function. It hurts and then it heals, right? What we're going to be focusing today is mostly chronic pain. And so this is going to be pain that they usually describe it as lasting longer than 3 months. It can be intermittent, right, on and off, but can be kind of pain that continues after healing that doesn't really have a productive purpose. So you get an injury and it's like your brain can't really recover. Or sometimes it occurs alongside of a chronic condition such as arthritis, right? And chronic pain and acute pain act different in the body, right? When we have chronic pain, it actually rewires your brain. So it shrinks your brain. It can reduce gray matter in your brain. And that is the area that is in charge of cognition, memory, learning, emotional responses. So that all gets impacted by long-term chronic pain. It also disrupts your nervous system. So we get heightened sensitivity. Our nerves are almost overreacting to things. Certain stimuli and things that aren't supposed to be painful can become painful because your brain is increasing the pain perception. So we do see that a lot. It's called allodynia. It's basically when something that isn't typically painful becomes painful to you. So examples could be wearing a jacket for dogs, right? Putting on their harness, getting wet, right? Touch, all of those things could be perceived as painful in their brain. Chronic pain also puts a lot of daily stress on the body. It's going to impact every part of your life, your GI, your movement, your rest, all of the things that are really important for kind of keeping things in balance. One of the main things we're going to be focusing on today is that chronic pain comes with a lot of compensation-based issues. And that is because most dogs have 4 legs. So it is very easy for them to offload and shift weight when they're uncomfortable somewhere. And the longer that goes on, the more it provides strain and stress on those other areas of the body that may be overworking. So one thing I like to just have you all do, and I talk to my clients about this a lot, is if you take your shirt and you kind of bunch it up around the side of you, you bunch it up tight, you're going to feel the tightness where you've bunched it. But then if you start to move your shoulder, right, you move your arm around, you move this arm, you're going to feel your shirt pulling in different directions from different areas, right? That's a really great example of how compensation-based pain feels. It might not be in the exact place where the pain started. Or I sometimes will see the compensation-based issues are actually more painful than the root issue because the dog has been compensating for so long. So that's something we're really going to want to keep in mind today when discussing pain and identifying pain. Unfortunately, pain is really, really common in dogs. There's a conservative estimate that about 1/3 of behavior cases have an underlying pain component. could be as high as 80%. So statistically, it's very likely. This is going to include musculoskeletal, GI pain, skin, dermatological issues, and dental pain, all of that kind of stuff. How does pain impact behavior? So Daniel Mills wrote a really interesting research paper that I have as a resource at the end, when he describes that pain can impact behavior in 4 ways. It can be a direct cause of the pain, right? We go to touch a dog's hind end and they're painful, they turn and growl at us. It can be a secondary issue. We see this a lot with separation related issues. If you don't feel good, you want to be closer to your caregiver, right? So we see that same thing happen with dogs. Unwanted behaviors are made worse by pain. This is very often what's going on. If we have a dog that is more prone to certain behaviors, pain and discomfort absolutely can lower a dog's threshold for tolerance of those things or make them more sensitive to those things. And then normalization of behavior signs that are associated with pain. So pain has become so normalized, the behaviors and symptoms of discomfort, that we kind of start to think it's addressing something else, right? Oh, that's a behavior issue, right? There is not pain going on because all adolescent dogs act this way or this breed acts like that. So normalizing these behaviors are causing issues as well. And this is a big deal because the longer that chronic pain goes untreated, the harder it becomes to manage. So the sooner we can recognize early signs of pain in our dogs, the longer lives they will have, the happier lives they're going to have. We can start to put things in place more quickly to help support them for what they need. In terms of learning, things to keep in mind is that chronic pain will reduce your dog's ability to learn. And so it can stall or stop progress, can kind of plateau you. We can accidentally generalize and sensitize further to triggers. Noise sensitivity is a huge one for this. So if we have a dog who every time they hear the garbage truck, they wince and it hurts, then they might start to associate that pain with other similar noises until it starts to branch out. And then big one, pain impacts mood, and mood is going to impact pain. So we have this kind of circular process that gets going where we can see the more stressed a dog is emotionally, the more painful they can be physically, and vice versa. So if pain is so common, why do we miss it? And again, a lot of times our brains are thinking of acute pain when we are thinking about what pain should look like. And so chronic pain defies our expectations a little bit. So some common misconceptions: dogs who are in pain cry out or they are obviously limping. Limping and crying out are often later stage symptoms. By the time a dog is fully limping on a limb, they are in an incredible amount of pain. Similar to like if a dog has dental issues, by the time they're not eating, it is incredibly painful. Another thing to consider with this myth is that chronic pain, again, looks different than acute pain. When we think of a dog who is limping, crying upon touching or palpitating, that is often more associated with how we would address acute pain and identify that, right? My dog wouldn't do X behavior if they were in pain. Fill in the blank. They wouldn't run, they wouldn't jump, they wouldn't play fetch, they wouldn't bark and lunge and hurt their body or jump on me if they were painful. Many painful dogs are highly active. Sometimes we actually see hyperactivity as a pain response, and we will see an example of that later. But most dogs will still move, do reinforcing things, avoid punishment, and things like that, even if they are uncomfortable in their body. We also see that it's normal for senior dogs to slow down. I think what we're actually seeing is we're normalizing the signs of pain in senior dogs, right? And it's reducing their quality of life. So yes, getting older comes with more likelihood that they'll have some more chronic conditions or they're more likely they'll be in pain, but that doesn't mean that it's normal for them to show signs of discomfort just because they're a senior. On the other side of that, my dog is too young to be in pain. I hear this one constantly. It is a very damaging misconception. So chronic conditions like hip dysplasia, they start in puppyhood. Puppies can become injured and those injuries can turn into chronic pain. We also see puppies that are raised on slippery flooring. It can change the laxicity in their joints and things like that. So it can make them more prone to discomfort. And a recent study found that about 40% of dogs between 8 months and 4 years old that we would mark as healthy looking dogs had early signs of arthritis. So this idea that chronic conditions only really happen in older dogs, arthritis, hip dysplasia, elbow dysplasia, are really unfounded. My vet ruled out pain. Chronic pain is so hard to diagnose in a vet setting. Your dog is often stressed at the vet. We might be using behavior meds that make them a little sedated. Those things are going to change their responses to the exam. You're also going to have usually more stoic behavior from our dogs at the vet. Compensation makes a big challenge for vets to find pain, chronic pain, because it's often not localized, right? It might be starting in the hips, but there's neck pain. There's all these other things from the compensation. So it's really hard. Your vet is only in there with you for like 15 minutes, and it's a really stressful environment. They're likely not going to be able to catch the things that we would see when your dog is more relaxed at home. Labels like my dog is just stubborn, they're dominant, they're dramatic, they're just weird, they've always moved that way. These are really dismissive of exploring more about pain and kind of being curious about why a behavior is happening. It really puts a period on the sentence, right? If we're just like, well, my dog stops on walks because he's stubborn. That's a label. It doesn't have a real definition. There could be so much more going on. So these words are often used as kind of placeholders. And then this is normal for the breed. So just because it's a breed specific standard does not mean that it's pain-free. We see that with dogs with short faces, long backs. Those things are inherently causing health issues in our dogs. So absolutely breed standards don't mean healthy. And I also will go back to labels with a breed just because herding breeds are nippy, quote unquote, right? Things like that doesn't mean that the behavior should be dismissed as that's just breed behavior. So a really great example of staying curious about pain and behavior. This is Matilda. This is our head trainer's newest addition to her family. She's an adolescent Chihuahua. She displayed some behaviors like separation-related distress, difficulty settling and resting. She's leash reactive. She has some stranger danger. And here are all the things that we could say about Matilda to kind of dismiss that pain as a factor in what's going on. Well, she's too young. She's an adolescent dog. Adolescent dogs don't have serious pain issues. She is a Chihuahua. They're known to be stubborn, right? They're dramatic dogs in general. As you can see in this video, this is her home alone shortly after they got her. She runs and plays and jumps. Look at her going from the couch to the ground. If she were painful, there is no way she would do those things, right? She didn't have obvious pain responses. There was no severe limping or crying. We all know small dogs are reactive, right? They're just like kind of, again, dramatic. And she's just a teenager. So a lot of these behaviors we can see when dogs are in adolescence because it's just harder for them as their brain is developing to cope with certain things. So she actually has grade 3 and grade 4 luxating patellas, and that is when the kneecap is shifting in and out of place. And these levels require surgery. She did have that surgery. She's doing very well. Her guardians actually adopted her knowing she would need this surgery, but their pain journey has been very well documented on Instagram. And it just goes to show that her hind legs were so uncomfortable. I saw videos of her offloading weight, kind of like stomping her foot down, almost like she was trying to like move her kneecap, right? Those things are impacting her day-to-day life. She's still running around the house, right? So we do have to be curious and thoughtful about when we're considering if pain is an issue. It's not as simple as I would just know. So let's talk about signs of pain. In daily movement, stopping on walks is a big sign of discomfort that we can see. Alternatively, pulling on leash or kind of always moving at a fast pace. So I have these dogs who are just go, 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 unable to stop moving. That can be common in dogs who are uncomfortable because they are offloading their sore joints and limbs faster. The trot is the most efficient gait for dogs. So if I have a painful dog, they might be trotting more than walking and moseying a little less, right? Because it's faster and more supportive to their body. If I hear groaning when they're moving into position or getting up, those are big signs of discomfort. If we see trembling limbs at all, shuffling limbs. So we might see dogs, if they're standing, they're kind of shuffling as they're standing quite a bit. So they're not able to evenly hold their weight. If you hear dragging or scuffing of nails on walks, that is a sign that they're not picking their foot up, right? So why is that? The bunny hop, a lot of people are familiar with the bunny hop, where it is when a dog is taking their hind limbs and pulling them up together, hopping like a rabbit. One thing to note about a bunny hop, for many dogs, it's normal for the first 2 or 3 strides when they're running to be a little bunny hoppish. I would look for after that what happens, right? But similarly, are we seeing bunny hopping like up and down the stairs? I would definitely make note of that to my vet. The head bob as well, I did want to demonstrate for you all here because it is one of the easiest ways to tell that there is lameness on the front limb. The hind limbs are a little bit trickier, but what happens with the head bob is we see the dog's head going up and down as they're walking. That's because they're using their head as a lever. They are pushing more weight down when their head is down. So that's the sound limb, right? And then they're pulling weight up on the effective limb, so less is being placed. So if the head is down, the limb is sound, is what they say. This is a good example, and you can already see that this guy is not holding all of his weight on that limb right there. And so we'll see bob up, because he is taking more weight on the right forward than the left. Abnormal posture. You don't have to be an expert to know that posture doesn't look normal. So some things I often tell clients to look for: paw positions. Are they turned in? Are they turned out? A lot of times that is coming from higher up issues. But again, if we can identify paws, it gives us a nice place to start. So you'll see here, ideally, when we're looking at a dog at the front and the back, we want to see pillars of straightness, symmetry, all of that. When we have paws turning out or in, it means that knees are either turning out or in, right? Their ankles are not positioned straight. So those are all going to be signs that they're offloading weight and it's not balanced. Similarly, a staggered stance. So you'll see with this guy here, he has a staggered stance. You can see one of his hind limbs is farther out, one of his front is farther out. So again, he's not holding his weight evenly on his body. A sloppy sit is a really big red flag for me. Absolutely considering do you have treats in your hand? A lot of our dogs, if we have treats or we're giving them cues during training, their sits are very beautiful and perfect. I'm more interested in what their natural sit looks like when nobody's watching, right? So we can see this shepherdy dog here has a nice square sit. Everything is straight. His knees are pointed straight. His paws are pointed straight. And then we've got a sloppier version of that sit where we have legs turning out. So some things I look for in a sit are sitting on top of their hip. So we can see that here with Ralphie. He's leaning on his hip. He's actually leaning on the wall as well in this photo, and he was a really big leaner. He leaned on walls, chairs, couches. He would lean on the fence when they were outside. So you can see that he is shifting a lot of weight to one side, and he's actually taking a lot of weight to the front end of his body. Similarly, we see Callie's leg here kind of going out. She's holding it out. It's straighter. She's not bending her knee as much. So that's a sign that there's discomfort. Sometimes we see like a little bit of a computer hunch and they kind of sit hunched. Those are all things that I'm going to take note of, try to get pictures of. We also might see muscle loss or overly muscled areas. So if I have a shoulder that is less muscly and the other one's really muscly, I'm going to kind of ask why, right? Because that would lead me to believe that the dog is bearing more weight, doing more work on one side than the other. We'll get more into actual kind of behaviors associated with pain now. Skin sensitivity includes a few things. We can have muscle or skin rippling either when we touch our dog or sometimes just randomly. You might see their back twitch. I see this a lot with dogs who have tension in their back and they start to lean forward to get a treat and like their back will ripple along their spine. Incomplete shake off. If a dog is uncomfortable, shaking off can be challenging. We would typically expect a dog to shake off from their nose to the tip of their tail, right? It's very erratic and silly looking. So if I have a dog who's very stationary in their shake off, or they don't completely shake off or stop and start, that is a big kind of sign for me. We're going to see this. This was my dog. She would shake off and stop at her shoulders. And so you'll see that here. So she stops right after her shoulders. She is not comfortable with the full shake off. Every once in a while, she would stop there and then she would start again as she got closer to her lumbar, her back of her spine, and she would do a little duck wiggle. So she had hip pain, but she also had a lot of shoulder and neck issues as well because she did a lot of weight shifting. Over grooming, excessive licking, scratching, biting, those can all be signs of discomfort. I see a lot of turning to suddenly look at a body part. That can again be random or when we touch a certain body part. It can often look like a dog has been like stung by a bee. So this is a good example. We see her suddenly kind of whoa, and then turn and orientate to her hip and start chewing and licking at it. We often see this when dogs are changing positions. See it a lot when dogs are kind of walking on walks too, if they stop suddenly and like start to bite at themselves, right? So something to be aware of. And then we did talk a little bit about this sensitivity to wearing clothing, harnessing, grooming, absolutely could be causing discomfort or even the anticipation of discomfort. Sometimes with things like wearing clothes or harnesses, it's the act of actually putting them on that is uncomfortable. So we might see aversion to doing these things or discomfort around them. Coat disruptions is a super interesting one we can look for. When there is a lack of blood flow to the body, it can disrupt the coat. So we see separation of the coat. The hair isn't going in the same direction. It can change texture, it can change color. Oftentimes I'll see thinning hair in certain places. So all of those things can be signs that there is tension in that area of the body. Sometimes we see X marks the spot. It is where the pain is actually rooted. This guy over here has hip dysplasia on his right hind, and you can tell he's got a very fluffy coat, so it can be harder sometimes to tell, like, is it an abnormality? But he has this big patch here where he has less hair and it's separated. This was consistent with photos and videos that I saw of him. And when we found out he had hip dysplasia on the right hind, I was like, oh, look, this is exactly where we marked his coat disruption. This is my dog. So she was a lab Great Pyrenees mix. So she had a wavier coat. We adopted her in 2017. In 2022 is when we did a pain investigation. We started treating and managing her hip pain. So you can see her coat and how wavy it is. This was her last year. Look at the difference. We were treating her in a multi-module pain management. She was on pain meds. She did PT. We had injections for her hips that helped support them. So she was doing really well in terms of feeling comfortable in her body. But you can tell she still has wavy hair, but it looks very different than there. She had a little bit of thinning kind of towards her tail, but she had discomfort there. Hepatitis. So this is a big one too. It's really common for me to work with people in behavior modification consults, and they say, oh, my dog really doesn't ever want to eat. They really don't want to eat in the morning, or sometimes they'll eat, other times they won't. They go off their food really easily. Those can all be symptoms of potentially GI, but we can see other issues too. So if their stomach hurts and they're eating food and then they start to associate that with pain, they might stop eating that food. My cat is like that. He has a GI, he's got GI issues. So we see that having to switch out food because that food he was eating doesn't feel safe anymore. Inhaling food. So if we have dogs that are really inhaling food, sometimes it's because they don't want to chew. So we might want to look into dental pain, or are they chewing on one side of their mouth, those kinds of things. I also look for stress responses around food. Do we see resource guarding around food? Do we see a dog where they're really excited to get their food, but as soon as you put it down, they kind of don't know what to do with it. They'll pick at it. They might take pieces and move them around the house, those kinds of things. Pica, which is eating things that are not technically edible. We see this a lot with mulch and grass. I see dogs eat carpet. Sometimes we'll see walls, those kinds of things with pica. Can be often linked to GI issues and other things. Stargazing is a little known GI symptom where the dog, often after eating, but not always, will kind of sit, lift their head up and look off into the distance and almost looks like they're in a little bit of a trance. So we will see this couple seconds, a couple minutes. I had a client whose dog did this for over an hour. And if you try to touch anything around him or him, he would try to bite. He had no other signs of GI discomfort, no vomiting, no diarrhea, nothing like that. They switched his food and the behavior completely stopped. And they figured out he was having some digestive issues, right? Still had some other guarding and things in other circumstances, but that scenario was completely resolved. Burping, hiccuping, smacking their lips a lot, if you hear like a gurgly tummy, if they're really gassy a lot, all of those are going to be things I want to bring up with my vet. A really nice example of a GI client I had, she was about 4 months old when this video I'm going to show you was taken. When I started working with her, she was just supposed to be a regular puppy client, just teaching basic puppy things. But as soon as we started working together, I noticed that she had some symptoms of distress. She was vomiting in the car and afraid of the car, which we can often see in puppies and with dogs who have sensitive stomachs. But she also was body rubbing, and we'll see that video here. So as soon as we walked into the apartment building, she started rubbing her body all over the wall. And I was like, does she do this a lot? Her mom's like, oh yeah, she does it all the time. And after some investigating, it was always her left side. And I was like, that's fascinating. That's really interesting. We should watch that. She also had stress around eating. When I first went into the apartment, I gave her a treat. She ate it. I gave her a second treat. She ran around the apartment with zoomies, holding the treat in her mouth, and then dropped it and didn't eat it. She had inconsistent eating. She displayed pica. So she had a lot of things that we would associate with GI distress. And we were able to get her diagnosed through these observations with IBD and then later pancreatitis. I will say she was so young when we started seeing these things that vet was very reluctant to believe that pain could be an issue and thought she was just a picky dog. Interestingly, her body rubbing reduces when her GI flares are controlled. Rest and relaxation. This is a huge one for emotional and physical health. Sleep is huge and rest is huge. So if we have a dog who's finding it hard to rest, maybe they're getting up a lot during the night, they're going from like the bed to a dog bed to the couch, they're moving around a lot, it's likely because they can't get comfortable. I had a dog who we'll see them like wake you up in the middle of the night as well. I did have a client whose dog was waking her up in the middle of the night. She thought she needed to go out to go to the bathroom, but she would never go. She was telling me, I think she's got GI issues. What actually was going on was she had some issues with her back. And once the dog was on pain medication, she was no longer waking up her mom. So it can sometimes look one way and we think it's one thing, and actually it's completely different. If they don't rest during the day, are they kind of following you around from room to room? Are they very vigilant? If we don't see them resting, we would expect most dogs to get anywhere from like 15 to 18 hours of sleep a day. So spread out, right? Napping throughout the day. But if we're not seeing enough sleep, that can have a drastic impact on the behavior that they're displaying, and it can increase their pain and discomfort. Certainly, if they have odd sleeping positions, we can see dogs who sploot out, right? Sometimes that is indicative of some stuff going on with their hips, right? Not always, but it can be. Sleeping with their heads up on something or hanging off. Sometimes people go, that doesn't look comfortable. It might be because they're trying to stretch or relieve some discomfort in a part of their body. And specifically difficulty settling and relaxing, even after we provided them with enrichment and physical exercise. So that is a big kind of, why can't you relax, right? Growling or snapping when they're disturbed while resting, or even just kind of irritability around being bothered while sleeping. So for example, sitting on the couch can sometimes move the dog. They might turn and look. Sometimes I have dogs who will growl or they'll leave and become a little irritable around that. It can physically cause them pain in that moment, right? Shifting and things like that. Or even just approaching a dog who's resting, who is feeling vulnerable and painful. The anticipation of pain, discomfort, stress, those things can cause those behaviors as well. Compulsive behaviors, so think like spinning, tail chasing, light chasing, flank sucking. We'll see fly snapping, so it looks like they're trying to catch flies, but there aren't any. All those things can be linked to discomfort. There is a really interesting article about compulsive behaviors and dermatological issues as well. So it's not something that we purely would say, oh, this is definitely a behavior issue. We need to be looking into both for that, for sure. And then a very counterintuitive behavior is hyperactive behaviors. So this can include mouthing, jumping, mounting people, objects, other animals, all of these kind of so much energy. It's like the dog can never calm down, never relax. Feels like dogs who are constantly moving can't be painful because why would they be doing these things? So this is a client, my most recent dynamic dog client. This is Callie. She is a 1.5-year-old pit mix. She was mounting, mouthing, jumping on her guardians for 10, 15 minutes at a time without interruption. This would happen 5 to 10 times a day. She would afterwards go and pant for like 30 minutes after the incident. She really struggled to sleep well. She was always restless. She had very inconsistent appetite. So we did a pain investigation on her. She was diagnosed with hip dysplasia. She'd been displaying these behaviors since puppyhood, and the vet was very dismissive that there was any possibility she could be painful. The guardian had asked for x-rays multiple times, wanted to do a pain trial of pain medication to see if it made a difference. The only thing they were able to get was trazodone, a behavior medication that actually ended up sedating Callie to the point where she wasn't doing the behaviors anymore, but it wasn't actually addressing anything. Once they got the x-ray, they got the diagnosis of hip dysplasia. She's off the trazodone. She's on pain meds. Her mom texted me shortly after to say, in just 2 days on pain meds, she's sleeping better. She's not eating the wall anymore. Her mounting incidents have severely decreased. If they even start, we can interrupt them. So a really good example of like the root cause of these really intense behaviors is pain for her. She's also displaying behaviors that, yes, can be typical for a teenage dog or a puppy, but the extreme level that they're happening at is abnormal, right? And mom was a positive reinforcement trainer. So all the things that she was trying to do, nothing was really having an effect. So a really great example of pain, especially in younger dogs, adolescent dogs, puppies, often comes out as hyperactive behavior, inability to rest, constant movement, as opposed to what we would expect, which is less movement, less activity. Toileting. I apologize to Fitz in this picture. I feel this is very embarrassing for him. House soiling. Do we have dogs who are having accidents in the house? Sometimes we can see this with neurological issues. I would see this actually one of the first signs that my dog was uncomfortable is she was peeing in the house. And throughout her pain journey, she struggled sometimes to consistently go to the bathroom outside, which can make sense if we've got musculoskeletal issues going on. It might be hard for them to get in a position that feels comfortable to go to the bathroom. And then by the time they come inside, they still have to go, right? So we can see house soiling, irregularity, right? In kind of how often they're going to the bathroom, or sometimes their stool is normal, sometimes it's not. So that kind of goes along with poor fecal score. There is a fecal chart that you can look up. It has beautiful pictures and descriptions of what normal poop should look like for dogs. And I always tell my clients it's worth tracking. A lot of times we don't realize that it might be abnormal until we start. Because even if your dog is only having kind of unexplainable diarrhea every month or two for just a couple days, that is still irregular. That's still abnormal. Not something we would want to document and address with the vet. We might also see straining, right? Straining can also be hard to identify. And I've had some clients say, I didn't realize my dog was straining until we switched the diet. So it's interesting to think about. For my dogs who lift their legs when they pee, do they lift both legs equally? Do they prefer one? Do they lift both legs as high up, right? Are they as sturdy in the leg that's on the ground? That can be a good notion of, are you as stable? And then my biggest marker of discomfort is an adapted poop stance, because squatting is a very hard position to maintain and hold if you're uncomfortable. So we will see dogs who kind of adapt their poop stance, who struggle to hold and maintain the squat. That gives us a good idea of if there's stability there. So we can see Fitz down here. He is a long-bodied dog. He is actually using the curb as kind of like a little stool for pooping. You can see he doesn't have a very deep squat. His knees are really straight. And he's actually got one of his front legs placed touching his hind legs so that he is getting most of his support there. So he has an altered poop stance. He also would walk while he pooped, and that is a sign of a dog who finds it difficult to maintain that position. This is Callie, who we saw in the last slide. She has a similar, very straight knee. Her stance is super wide, and she isn't getting a deep squat. I'll sometimes see dogs squat really deep, and then halfway through, it's like they kind of push up again because they can't maintain it. So looking at how your dog poops actually can tell us quite a bit about how they're feeling physically. Some other behavior challenges that we want to discuss: Jekyll and Hyde behaviors. So behavior that seems like it's hot or cold, just comes out of nowhere, the dog is fine, then they're not, right? Certainly sometimes this can be because we miss body language signals, right? We might get a growl and a snap and we miss the lip licking or the whale eye, right? The white of the eye showing. But in a lot of these cases with discomfort, I'll see dogs who, again, some days they're fine, some days they're not. Some incidents they're okay with triggers, and other times there isn't, and there's not really any explanation for it. We can see handling discomfort. That makes a lot of sense if you're uncomfortable or you're anticipating discomfort. So this could include grooming, vet handling, right? Or even just petting. A lot of my clients will say the dog really knows the difference between cooperative care and like getting the nail clippers out versus just handling their paws. There is more tension. There's more of those things that could be causing more discomfort, right? They have to hold their bodies in ways that might be less comfortable. Leash reactivity and conflict with other animals, absolutely. Very common to see dogs who can exist neutrally around other dogs until they turn to sniff their butts or they linger too long in one place. That can be a trigger for those dogs. Distress in the car is a big one. We often associate that with GI discomfort, the dog is vomiting, those kinds of things, lots of drooling in the car, but it actually can make sense from a musculoskeletal point as well. The car is moving, it's not very stable. Dogs are usually in seats that are not built to hold dogs. So there has to be a lot of support and soundness in their structure to be able to maintain standing and sitting and laying comfortably in the car. If you think about if you've ever had like a bad neck or back, you're in the car and you hit like a pothole and you're, oh, it's so painful. Or sometimes even the anticipation that you're going to hit something and like bump, right, is enough to cause distress and make you tense your body further. So we do see this as the dog's stressed in the car. They don't want to get in and out. That could also be because the act of getting in and out hurts. This is really common too. If I see this as a sudden development in dogs that were once previously okay in the car, it is an immediate, there is likely a pain factor going on in this. This is Zephyr. He was a year and a half when I did his pain assessment. He had some of these behaviors, including dog reactivity. He would bark, pull, and spin when he would see other dogs on leash. And then he would become frustrated. He would mount his guardians. He would bite up at the leash. They did tell me that he always had difficulty navigating slippery flooring, which we found interesting, although he was fluffy, so they didn't know if it was just his paw pads being extra fluffy. And he was very stressed in the car. So interestingly, with Zephyr, he was very Jekyll and Hyde. He did so well with his training program. He was working with a JW trainer. She was like, I see so much progress in him. And then he'll have days where it's like he never did any training in his life, right? He couldn't retain or cope or handle the situation enough to utilize those skills that he had learned. So she noticed a very small irregularity in his gait, and he was tricky. He was really young. He actually moved really well, and we figured out that after exercise, he moved differently. So when he was fatigued, his body moved differently, and likely why we were seeing such hot and cold behavior from him. And he got diagnosed with hip dysplasia on his right hind that was causing him to be lame intermittently. So he's from the coat description, he was the fluffy dog where we saw disruption on his right hind. So this is him popping out of a down. He was playing in this yard. They were getting some video for me. I want you to watch his right hind leg. That's the one closest to the camera. So he's going to pop up, and then he takes a step, he lifts his left foot, and he drags his right. and he lifts his left foot and the right drags behind it. Very subtle, right? Not a very obvious thing. I've slowed it down. I saw this happen multiple times with him after jumping on and off things, after playing, after a lot of movement. So he was intermittently doing this, right? And it was a sign that he was uncomfortable. Some other behavior challenges we see linked to pain, separation related to stress, which we did discuss a little bit. If a dog is uncomfortable, they want to be close to the person who makes them feel safe, right? We see that with kids too. When you have a stomach ache, you want to be their parents, right? So we can see that as part of the issue. Stranger danger, I see this a lot with painful dogs. There might be already stress about someone new coming into the home and it escalates that fear. Or sometimes we see dogs who are truly very conflicted about wanting to greet people and go up to people, but then the way people are handling and interacting can cause discomfort or perceived perception that it's going to hurt. And then it makes sense that that dog would not want visitors in their house, right? Avoidance behaviors, dogs who don't want to go out on walks, don't want to put their harness on, those kinds of things. Resource guarding is a good one too. We talked a little bit about that with food and appetite, but we can also see dogs who guard space, who guard objects. Sometimes I think resource guarding gets confused with dogs don't want to be disturbed while resting. So sometimes I think that can happen, but we do also see guarding of resources increase when dogs are more painful. And noise sensitivity is a big one as well. So if something happens and your dog tenses up, it causes pain, then of course they are going to show avoidance stress behaviors around noises. This guy is Brooks. So he came to me as just a regular behavior consultant client. His mom is so lovely. She actually had seen 2 or 3 positive reinforcement trainers, really good trainers in the area, really wasn't seeing a lot of progress. When we talked, I brought up the idea of maybe potential pain. She's like, well, I've been seeing that stuff online. I actually asked my vet if it was potentially something that could be going on. The vet was very open to the idea, but just couldn't really identify anything specific. So he's one of my few dogs who, like, he was at the vet very recently before I came in and started working with them. He had barking and lunging at dogs on leash. He could struggle with kind of settling over excitement with guests. He was noise sensitive. He also, interestingly, would startle very easily if his guardian would sit a little too closely to him. So again, a little bit of that, like if I shift the couch or you perceive me as being too close to touching a place that is painful, they might leave or they might kind of look or startle, right? And he's kind of on his pain journey still, but he was diagnosed with hindlimbless on both legs, kind of intermittently, so off and on. And the vet is currently looking into like CCL tears, hip dysplasia, or lumbar disease. He had some inflamed knees when we started working together. So it was really interesting to kind of see someone who had done all the right things in terms of training, but hitting this plateau because there is also another component to what's going on, right? You can see he has a little bit of an irregular gait there. And we can tell that because his left hind is actually moving out and around instead of straight forward. So if we look at his left hind, his toe is going to go out and around, whereas the other one moves straight forward. So when we're looking at dogs moving from behind from the right angle, we should kind of see their front and hind leg moving in tandem. We really shouldn't see all the legs separated, right? He's such a sweet guy. So now that we've looked at pretty much so much stuff that could potentially be pain, right? What do we do if we suspect pain in our dogs? So advocating for your dog starts at home. The biggest thing we can do for our dogs is non-slip flooring. Even if we don't suspect pain in our dogs, non-slip flooring. In high areas of traffic where your dog eats, stairs, not just the stairs themselves, but the landings of the stairs, having non-slip so the dog doesn't slip as they come off of navigating that. Essentially, a dog navigating a slippery floor is like us walking on ice, right? So even if let's say we absolutely are positive there's no pain component, we are still working with a dog who feels unstable. And so that is going to cause stress and anxiety. and that we know can impact pain. But we also have dogs who struggle to navigate the flooring because they are uncomfortable. And from another perspective, slippery flooring is a big risk for injury. So especially puppies, we can see them easily injure themselves or overstretch as their growth plates are closing, those kinds of things. So slippery flooring is a no-go. I love like a yoga mat. My husband had a bunch of carpet tiles that he got and he put in our laundry room. Our cat's litter box was there, and when our dog was alive, she loved a good litter box dig. She mostly left that one alone. And we were like, oh, she's just so good. She just leaves this one alone. Soon as he put the carpet tile in, the next day she was in the litter box because she could actually go into that room, stand and support herself while she leaned forward to dig in there, right? So a really great example of like the way our house is set up has to be accessible for our dogs. We might not knowingly be blocking them from certain areas of our home. Multiple easy access to resting spots is a big one as well. If it's hard for dogs to get comfortable, we want them to have a lot of different options. If you have a high bed or high couch, a ramp, or even just like an ottoman to step up on can be helpful. Those things can make resting easier for your dog. We can limit repetitive, high intense physical activities. So these are things like fetch. This is like a big hot topic, so don't come at me. But fetch is high intensity. It is a lot of repetitive stopping short, twisting, turning, sometimes rolling, right? All these things, jumping. These kinds of movements over time are a recipe for injury. If we have a dog who's already painful, they will make the pain worse later. A lot of times my clients, when we talk about this, are very like, my dog loves fetch. They love doing this stuff. And I'm like, one of the reasons they might like it so much is because when dogs are doing a high intense activity like this, same with humans, they are releasing a ton of like cortisol, adrenaline, all of these hormones that flood your brain that actually act as a suppressant for pain. So it can dull your pain, right? If anyone was watching the Olympics, how many athletes would the announcers be like, oh, look, she's working on a torn ACL. And like, we're like, oh my gosh, that's so painful. But again, the adrenaline can pump them through it. We can move through pain. So it's similar for our dogs as they can still do these activities and be painful. And it can still be bad for them. And sometimes we see them actually seeking them out because it reduces pain in that moment, right? And then being really mindful about our training and behavior modification. So one, our training methods. If we're using punishment and our dog is painful, what are we doing, right? Like what are we hoping to have happen? We can't train pain away. And especially with punishment, we are just then punishing and causing emotional or physical distress to a dog that is already experiencing that. But even with positive reinforcement, if I have a dog who is uncomfortable or we suspect pain, if I'm asking them to move into positions that are really uncomfortable for them or to do behaviors that cause them discomfort, that's no longer positive reinforcement, right? If I'm telling clients it's purely a training issue, let's just get them on behavior meds and not look into pain at all. Again, that's not really ethical. So really considering our training methods that we're using and also individualizing these plans for these specific dogs. The terrain that you train on, we don't have to train our dogs on slippery floors. Go to the area rug, put a yoga mat down, especially for puppies. We really want them to have stability when they're training. So that can be a really easy thing we can put in place. Thinking about what we're asking our dog to do. Does our dog need to lay down? Do they need to sit, right? And then in that realm, don't require something that could potentially be painful for reinforcement for our dogs. So example, I ask my dog to sit and I put the food bowl down and then I release them. Or I ask my dog to sit before they get to go outside. If I have a dog who's uncomfortable, it means I'm forcing them into a painful scenario just to access their right to food, their right to being outside, right? So we really want to be thoughtful about how we approach that, and look for alternative options, or again, kind of asking, is it necessary at all for our dogs to do these things? So we can do a lot of things at home that can advocate for our dogs, can make them a lot more comfortable. And that is part of a multi-module pain plan. At the vet, track the behavior and physical symptoms that you see from your dog. Get video evidence, get photos, bring them to your vet. There is a really nice resource for dog guardians and for trainers, the Canine Arthritis Management website. They mostly talk about arthritis, but they have a lot of great resources on chronic pain, on home adaptations, talking to your vet, all of that. And they have a free download of a suspicion of chronic pain worksheet that you can see here. So this could be helpful if you're just trying to like organize some thoughts, right? It gives you a couple of things to go off of. I often would just like email myself a bulleted list and pictures to show my vet if I needed to. Trust your gut. Most people, if they suspect their dog is painful, they likely are. Statistically, it's highly likely. We know it's hard to find in a vet setting if there's chronic pain. So what can often happen is my clients think that there might be pain. They don't necessarily know how to describe it, where things might be going wrong. It impacts how they can talk to their vet, right? Those things then can make it just harder for us to talk about it and get our point across. So if you think your dog is painful, absolutely, you're probably right. And you absolutely should bring that up with your vet. But sometimes we do have vets who are not receptive to that, right? So don't be afraid to get a second opinion if that is an option. And of course, getting a formal pain assessment or a gait analysis to take to your vet can be very helpful because it does kind of lay out all of the potential areas of discomfort for them to actually see instead of having to kind of find a needle in a haystack, right? When do we maybe consider a formal assessment? So if I have clients who describe their dogs as clumsy, stiff, awkward when they're moving, it might be time for an assessment because again, we might not have the exact words for what we're seeing, but we often can use labels like clumsy, stiff, right? They've just always looked kind of funky, right? I have a lot of that, like their hind legs always just kind of move in ways that I don't think are correct, right? So if that's something that you described your dog as, I might consider doing a more formal assessment. Sudden or new behavior challenges, absolutely, or behavior challenges that have intensified in frequency and severity. Maybe they were ones you kind of resolved with training and now they're getting worse, or just completely new behaviors. Always, always, always want to look into pain. If I see Jekyll and Hyde behavior, definitely. If you've seen multiple trainers with very little progress, right? Because we know pain can impact how an animal learns and how they can actually use that information. Some training can only get us so far sometimes, right? And if there's pain, we can't train that away. If we see really large dips in behavior progress that don't add up, so Zephyr is a really good example of this. He was doing great with his training until he wasn't, right? He'd have those days where it was like nothing was going on. And then he'd have days where he was really distressed, right? So they don't really make sense in how he's progressing. Dogs who've been on multiple behavior meds with no significant change, and I do see this a lot, unfortunately, whereas if we're convinced something is a behavior problem, then we're only going to treat it in the realms of a behavior problem. So I love behavior meds. When they are appropriate, they are life-changing for dogs and their guardians. And sometimes we see behavior meds as part of a pain management plan because stress increases pain and pain increases stress. So absolutely, behavior meds could be part of a pain plan. It's not that we should never use them, but if we're utilizing behavior medication specifically with sedation qualities and we're not seeing any progress, then it's going to lead me to believe that there's something else potentially going on that we should be investigating as well, right? And if you need help communicating with your vet, going to the vet can be stressful, especially if you have a dog who has some sensitivity to going to the vet that needs to be fully sedated, that doesn't like to be handled. We're already on guard when we're at the vet in that way for our dog. And then we have to talk about a complex, stressful subject with very little to go on. So having a way to kind of say to your vet, here is what we think is going on. How do we investigate this further in terms of what might be going on and where the dog is painful? And of course, too, if your vet is not on board, if we have vets who are resistant, it does sometimes happen. In my experience, it's mostly just vets who again, they can't find what they can't see in that moment, right? Or it might not be their specialty. So that can be hard. But I do have some times where vets are really just resistant to the idea that pain is going to look a different way than they expect. And a formal pain assessment can really help with that. The benefits of a pain assessment, they can help empower you to advocate for your dog. You start to know what to look for. It's hands off. So if we have dogs who do not enjoy being handled or touched, you get all the video yourself in your home so they don't have to be stressed. It really does help with communication with the vet, especially if we're struggling, kind of advocating for our dog. I don't diagnose. I can't tell you exactly what's going on with the dog, but it does act as almost like holding up a magnifying glass to the dog to see which areas are uncomfortable and exactly what's going on with those movements or posture, in addition to the behavior that they're displaying. So that can kind of clue in the vet on where to start and where to look. And then it's nice because you can collaborate with a current trainer and your vet. You don't have to start all over with someone new. But the biggest takeaway from this is early pain detection prevents one of the most common reasons for non-behavioral euthanasia, and that is pain management. We often have dogs who, by the time we investigate and realize their pain, it is so hard to keep them comfortable. And so that is a huge reason for euthanasia. And early pain detection is going to really impact quality of life and length of life. Really quickly, just an idea of what a pain assessment looks like for me. So I do pain assessments through JW. We have a couple different options right now, but they all include a complete medical and behavior history. We collect data of the dog in different positions, standing, sitting, down, different gaits, walking and trotting from all of the angles, videos of them moving into different positions. And big one is activities of daily living. So eating, drinking, going to the bathroom, up and down stairs, basically it is like a mini snapshot of your dog's day-to-day life and movement. And then we get a report written for the vet of any abnormalities, and it includes labeled photos and video evidence. I do a 30-minute follow-up with the guardians to go over all of that. The report goes directly to your vet. And in some cases, I can attend virtual vet appointments with my clients if they need additional support. Although a lot of times by the time we get to the end of the report, my clients are feeling really confident in what they're seeing. They feel very validated. So that is always really nice. So that is everything. If anybody has questions, I'm happy to answer them.
That was fantastic, Kat. Lots and lots of great information. There are plenty of questions in the chat. Let me just scroll back and find some. All right, so first one, thanks for all the information, Kat. You discussed a lot of potential signs of pain. Is noticing one of these in our dogs enough to recommend digging in more, or multiple signs typically present? So a single
It's a great
sign or
question.
multiple?
Yeah, I think it, like all good questions, it's going to depend a lot. Certainly some of those lesser ones, I might think like, oh, okay, maybe how often do you do it, right? Is it happening really frequent? Are you always turning to look at your hind end every time you stand up, or it's happening multiple times a week versus maybe once or twice we see this behavior? Similar to like behavior modification, we're really looking at frequency and severity and then a combination of also the factors. I would say anytime I hear of behaviors that are having difficulty with behavior modification or behavior medication, I'm very interested in seeing if there are some more subtle postural or gait abnormalities, because those are often really, really hard to find unless you're looking through videos, slowing them down and really studying them. So we could still see less of those symptoms, but there still could be more gait and physical abnormalities going on. So I think it's always worth noting, investigating, talking to your vet about, and of course, digging in deeper if we're suspecting other things. So if they're showing one physical sign of discomfort, right, are they snapping when I approach when they're resting? Like, I think that those things are big enough to absolutely warrant investigating.
Excellent. So I've mentioned my suspicion of pain in one of my dogs, but it was dismissed after an exam. Do I need to get a referral to a specialist, or do they take on cases without referral? And same person asked, added to this, how do I get a pain assessment?
Yeah. So absolutely, you can ask your vet for referrals if which can be helpful in terms of just knowing who to go to. But depending on insurance, because some of my clients, if they're using insurance, they might need a referral, but you can just seek out specialists and book appointments with them in most cases. Sometimes they do require a vet referral, in which case I will often suggest to clients saying, so I know that this is as far as you're willing to investigate this. If I wanted to investigate this further with some specialists, could you give me a list? Right? We can absolutely say that. But for like rehab vets, sports medicine vets, a lot of times you can just go to a specialist and state your concerns. In terms of getting a pain assessment, we do offer them through jwdogtraining.com. So you can go and take a look. We have a couple different options. I'm really happy that we have a much more affordable option for clients that is a little more accessible now. So that is a good place to start in terms of getting like a full assessment of your dog's day-to-day life.
Excellent. So, Catherine writes, my dog shows so many of these signs. He's currently recovering from dental work, and we've been working on the GI issues. He's reactive, noise sensitive, goes to bite his rear as if he's just been bit by a mosquito, refuses to relieve himself on the grass patch, puppy pad on the balcony. They have an apartment building with no yard problems. Also doesn't take food outside, so training is difficult to apply outside the home, aversion to handling, petting, and grooming. She doesn't specifically ask a question. I don't know if she's saying, should you get more information? Catherine, if you have more to add to this, please type it in. Any comments on that, Kat?
Oh yeah, that's like a laundry list of the pain signs. So I think too, what's helpful is one, once we know what to look for, sometimes then it's like hitting us over the head and it can be really overwhelming. But I think remembering too is sometimes miscommunication with our vet comes from lack of information because we don't know we should be giving it. So I do have, when I do my consults with my clients, whether it's a pain consult or just a regular behavior consult, I'm going to tell them, I want to know everything that your dog does, even if you think it's not important, because it likely is connected. So even just identifying what's going on with your dog and being able to write them down can kind of help with that building the connections between those things, as opposed to, well, this isn't really a vet issue, right? If my dog is doing this behavior, I don't really need to talk to my vet about this. Or this isn't my trainer's problem. I shouldn't talk to them about the GI discomfort, right? They're all working together. So absolutely write it down, make note of it. Nothing is ever too small, in my opinion, to share with someone just to go, this might be part of it.
Right, and she did add any next steps. So I think that was kind of next step. Any other
Yeah.
things to add as next steps?
Videos and photos, especially if they have very obvious, like sloppy sits, that's a big one. Being really mindful when we're getting these things of not using food to kind of disrupt the behavior, because I've seen so many dogs who food is present and then suddenly it's like they move really perfectly and then the guardian puts the food bag down and I'm watching them on the video recording and the dog immediately like lowers their head and starts walking differently. So kind of getting natural video and movement if you can, and really bringing that to your vet with a list can kind of help you stay on track and making sure you're hitting all of the things that you wanted to talk about.
So Judy writes, my 13-year-old dog is a constant patient of the vet's. Her dog has a problem with each of her organs, but she's still happy and energetic with all the vet treatments. What do you recommend for a cardiac yet obese dog?
In terms of, I guess maybe like weight loss,
I'm not sure. Judy, can you
clarifying.
just add a little more detail to that? Diet, meds, etc.
Yeah. So that is absolutely like going along with your vet. I'm not a vet. However, I will say when we are looking at weight loss, it is really common to kind of like shame guardians for their dogs being overweight. We do know that it can contribute to the health issues and pain. However, we also have to consider that dogs that are overweight and are uncomfortable, if we're expecting them to do more exercise to lose weight, we have to have a pain management plan for them. I had a client who she was this lovely pug, overweight, had a lot of gait and posture abnormalities. They put her on, they were doing a pain trial of an anti-inflammatory. Her mom was like, she's moving a lot better. And the next time I saw her, like between sessions, it was like a month. I was like, oh, she's lost weight. She's like, yeah, she's feeling a lot better. She's moving a lot better. So we have to keep those things in mind. It's never as simple as, oh, we just cut calories, we make the dog move, and they'll lose weight and then they'll feel better. Like they have to feel good in the body they have to the best of their ability, right?
Great, excellent. Let's see. Robin has a question. 6-month-old Schnauzer. Let's see. She's a dog minder, walking and rubbing body through legs when walking excessively, like an eel weaving through reeds.
Mm.
Though maybe age related, but could it be potentially be pain? Not lifting her legs when peeing, crooked sit, jumping up excessively, panting, hyperactive mouthing. Assume these things were due to his age, vocalizing like in a high-pitched excitement, barking, also panting, relaxes with mental activity like training activity, needs non-slip flooring up the hallway. So does this sound like these are potential pain related?
Yeah, so I really try to look at the intensity, right? We expect puppies to be mouthy or have some difficulty settling, and it's really for me looking at, are these behaviors easy to modify with an enrichment schedule? Can we interrupt these behaviors and redirect the dog easily? Schnauzers are notorious for having health issues as well, right? So we're looking at things like that. Again, from my perspective, it's always worth investigating if we're seeing anything. I think with puppies, it's very easy to dismiss any kind of muscular skeletal. It's important to remember too, with puppies, we could even have growth pain. This tends to be for larger breed dogs, but it can still impact them, right? So we can see that there can be discomfort even just throughout adolescence as they're growing, or they could have something that is already starting, right? So absolutely investigating pain would be for dogs like that, really looking into the details of their movements and posture. It can be hard again because puppies are very flexible because their growth plates haven't closed yet. So we do sometimes see sloppy sits. We see certain movements that might be more normal for them. Um, I will say though, a lot of my clients have had their dogs since puppyhood, and I will be like, have they always sat like this? And they'll send me pictures and they're sitting exactly the same way. So some things I'm like, yes, it could be this, but if it's paired with so many other signs of potential pain and discomfort, again, it's it's our job to push for some investigation from that because it can only help give them more answers to the puzzle.
Yeah, one note about that too, Robin, is not lifting their leg when peeing. That is, from my understanding, more of a learned activity. Some male dogs never ever through their lifetime ever learn to lift their leg when they pee. Some females do lift their leg when they pee. So that in itself, a 6-month-old dog not lifting its leg to pee would be considered completely normal behavior. So unless it's associated with other things, that wouldn't be a red flag for me. The other thing I was thinking too is, you're talking up, young dogs should never be in pain. And what we're learning more of is things like chiropractic care for infants right after they've been born has been found to be a huge help because of the contortions they go through during birth. And, it could very easily apply to dogs as well. Who knows? It might be something to think about.
Yeah, no, definitely. I think again, this assumption that because it doesn't look the way we expect it to look, it can't be pain, I think is really
Yeah.
a challenge here. And so not even necessarily going, my dog is definitely in pain and this is the only issue that's occurring. This needs to be part of the modification of behavior and the building quality of life for our dogs, right? It is a piece of
Yeah,
the puzzle kind of in their wellness. We can't
exactly.
just focus on behavior.
Great way to put it. Yeah. Let's see, Debbie. Several symptoms seem similar to what you'd also see with anxiety. Good question. How do you differentiate the cause of it? Could it be anxiety, pain, something else, or I would add even both?
Yeah, for sure. And again, remembering that We can see behavior being the root cause. We can see it as a secondary. We can see it in combination with things. So it can escalate behaviors. So for me, I'm going to look at the dog itself physically. Are there postural? Are there gait abnormalities, even super subtle, right? That we saw that dog Zephyr dragging his foot very subtly. Those kinds of things. Is the dog responding to training? Positive reinforcement, well done. Behavior modification. Have we tried behavior medication? Have those had any effect on the dog? Those are all things I would think about. But also knowing the connection between anxiety and the gut, right? That's something that we've kind of really been learning a lot about, the connection between anxiety and the stomach. So this idea that is really common for dogs to display anxiety and have GI pain, and sometimes it's, well, what came first, or are they kind of working together? I think is a big one. There's an interesting study, it's actually here on this slide, for evidence between hypermobility in the hip joints of dogs and the increase in excitability and anxiety. And there is a connection between humans who are hypermobile and anxiety and kind of overstimulation. So a lot of those things that we know are true for humans, we also are finding out are true for dogs as well. So I think a long-winded way of saying severity, frequency, am I seeing other changes in the dog physically? And it, it's worth exploring for sure, right? How are they responding to the other treatments for these things? But knowing that it's likely if there's an anxiety component, it puts a dog statistically higher to have GI because they're very often occurring together.
So Robin added with the Schnauzer, seems to have separation issues. She's looking after him when the owner is out for longer than 4 hours. She's considering setting up cameras. Kat, do you have any comments about separation anxiety and how that could be influenced by pain?
Yeah, I think that it is more common than we think. I also think for puppies, it can be hard because sometimes what clients come telling me is separation anxiety is actually a dog who's not been taught kind of slowly and gradually how to kind of cope with being by themselves. So it can be hard in that developmental stage as well when puppies are, of course, much more wanting to be with people and dogs are social in general. So there's that caveat. But yes, if we don't feel well, we want to be with the people who make us feel safe, right? We see that with kids or even adults. Like I like when my cats are near me when I don't feel good, it makes me feel more secure. And that can really help. We know people who are recovering from cancer do better when they have support systems in place, right? And connection. So I think those things go hand in hand naturally. Again, for me, when I don't see behavior and physical issues as separate anymore. I'm basically saying if I see these behaviors or I see these physical signs, to me, that is a sign that there is a stress response happening, and that could be pain. It could also be emotional, or it could be both. So I think our human brains really want to be able to be like, it's this or that, and this is how we know it's this or that. But it's so complex and interwoven that it's impossible to separate them sometimes.
Let's see. Debbie, is a sloppy sit always a sign of pain? I've seen several puppies who sit sort of sloppy and otherwise appear and act fine.
Yeah, so not always, again, especially for puppies because their joints are kind of all over the place when they're younger. But it is not uncommon for me to see puppies who have the exact same sit. There was a picture of one of the dogs sitting against the wall. And I was like, has he always done that? And they're like, oh, yeah, this is him as a baby. And it was like, it's like a frame for frame, the exact same shot, right? So for me, I'm pairing that with this is now on my radar. I'm going to put in the back of my brain. I'm going to start looking for behavior. I'm going to start looking for other potential abnormalities. And as the dog grows, I'm going to start to see, does this change, right? So again, one thing might prompt me to be curious, and then we kind of continue to observe and watch. But I think that it is often dismissed in puppies because we know that their joints are super flexy. But even a dog who's developing like hyper flexible joints can cause issues later on. So it's not always going to be as easy as a yes or no, but absolutely, I would still be holding on to that as I need more information about this.
Yeah. Couple of questions about, well, let me read these. They're both a little bit long, but they're related. My dog has IBD, working with an internist for management. I've noticed that she starts showing pain-related symptoms sometimes a whole week before her GI issues show up. And she needs some help communicating with the vet. They brought this up as we focused on the GI issues more than the behavior. It can be confusing for me as to when to prioritize behavior over GI. Dog is also nervous, and all of her training understandably goes out the window when she's in pain for the GI because they're unable to give her really high value treats due to diet restrictions. The other one is similar. I can relate to this. Their dog Rosie has GI issues that they've explored. Elimination diet has gotten it a bit under control. They're exploring pain in her spine and hips. And anytime she has an increase in pain symptoms, it causes her GI issues to flare up. And so pain related to GI issues, and then how do you discuss kind of the whole picture with the vet as to what to focus on, what you're struggling with more, that whole ball of wax.
Yeah, and it's GI is so tricky and it's so hard to like fully investigate. One thing that can be noted too is GI can also increase other types of pain. So for my own dog, when she did have GI sensitivity as well, especially as she got older. If she was having diarrhea, it immediately, I was like, oh no, she's going to be squatting more, she's going to be straining more, her hips are going to hurt more, right? So we can see that kind of factor in as well. With this idea that it can make other things much more uncomfortable. They're getting less sleep. That's going to increase musculoskeletal pain or things like that, right? So GI is a really, really tricky one. I find it really interesting that you can tell like a week in advance before she has the physical symptoms. I'm a really big proponent of, again, behavioral challenges and signs are communication to us. So if I have a dog who is starting to eat things off the ground that are not edible and they're starting to get really hyperactive or more reactive to things. And then I know that following that is likely going to be a GI issue. Perhaps is it the GI issue starting before the symptoms are really obvious? Yes, maybe. Or is it stress causing the GI rate? It could all be very hard to know which is coming first or if they're all working together. But I'm a big fan of once we actually are aware of the pain issue, the behaviors that accompany it, we can actually use it as a warning sign. So, for example, with my dog, she was always very barky because she was a livestock dog, but she was significantly more noise sensitive when she was painful. And so once we got her on a treatment plan that worked well, I could tell days where she was struggling because she would be barking more at things that normally would not bother her. So using that for me, I would go, oh, I think I'm going to give you your extra pain med that your vet said was okay, right? Like this is what my vet has said when we are experiencing physical discomfort, do this to kind of prevent a longer term flare up. And that might be how I approach it with your vet is, so I've noticed a connection between these behaviors and then a week out GI distress. Is there something I can do as soon as I notice that there's distress happening that might prevent or help reduce the length or intensity of the flare up? I think that is really a smart thing to have and kind of be like, I can recognize it before it gets really bad and then implement, hopefully, with your vet's approval, something that could potentially reduce it or sometimes even stop it in its tracks a little bit. I do that with my cat. For a while, it was if he started lip smacking, he got anti-nausea meds to prevent him from going into this big spiral of I have a stomach ache and now I'm vomiting and now I'm having trouble eating. So it does, especially with GI, like once something starts, I feel like it just goes really quickly.
Let's see, Carolyn. My dog lifts his left hind off the ground, but the right is on the ground during peeing. Is this a sign of pain in the left? She's female.
Potentially, if I have dogs who are not bearing weight evenly on their body, I will always document that and let the vet know. Um, it's sometimes with small dogs too, they'll be like, "Oh, it's so funny how my Chihuahua like does a handstand when they go to the bathroom," and I'm like, no, we need to investigate that as a discomfort. Again, the squatting, whether to pee or to poop, is an incredibly difficult position to maintain. So if I notice uneven weight bearing or tremoring or a lot of weight shifting in some way, absolutely want to investigate it.
All right, Grace asks, does a pain assessment only go over musculoskeletal issues? I'm hearing you discuss GI issues, and I suspect my anxious 3-year-old Shepherd mix has a little bit of both.
Yeah, nope. So we include everything in that. Again, it is going to look at and depending on the type of consultation you do, but we always go over behavior and what behavior is linked to discomfort. I put in a history, and I usually will mark studies that link to those behaviors and pain for the vet to look at as well. And then we go over the actual physical evidence that we're seeing from the dog. But in terms of things like GI or skin issues, we can see dogs turning to look at body parts or biting at compulsive behaviors, right? For GI, like stretching a lot, like into downward dog, can be a common symptom of trying to relieve stress. I always ask all of my clients about nutrition and appetite, and I always explain stargazing because it's a really not well known, but very linked to GI distress. So we do our best to find everything that is abnormal within both how the dog looks and moves and their behavior. So it's quite detailed. But things like GI will cause other issues to, if they're tension and tightness in the body, all of those things can then kind of work together, unfortunately. But yeah, absolutely looking for dental pain, those kinds of things too.
Excellent. Christine's got a great question. We've seen 2 ortho specialists, 2 pain specialists, and now waiting a neuro appointment. Imaging. It's pretty unremarkable so far. They did X-ray and CT. Has dog reactivity, gear shyness, noise sensitivity. They've all improved the most with carprofen and SSRI. Gabapentin did not help. And so what she's asking is, how often do you never find the source of pain?
Pain journeys can be daunting and very long. And just like with people, we have people with chronic pain we're investigating is really challenging, and they can physically tell us all their symptoms, right? So I kind of like, the running joke is like, my best case scenario, if we suspect pain, is like the dog gets an x-ray and we find something on the x-ray, because that's usually the first line of defense in terms of trying to get a diagnostic. But you can have a clear x-ray, a clear CT, a clear MRI, and there can still be pain. And this can be one because potentially it's, again, not something that would show up in that. But we can also see chronic pain is maladaptive pain, right? So it can stem and be perceived as pain, even if there is not a painful, like an actual thing going on. And we can see that with certain autoimmune disorders. I have fibromyalgia. That is a big fibromyalgia thing. Like nothing in my body is actually being affected, but I'm perceiving pain at a heightened state. So that can be part of the issue, or sometimes again it's the compensation. But it is really frustrating when we're trying to, like, we know something is off, but trying to determine and get the diagnostics, sometimes it is just a really uphill battle, unfortunately. So it's because chronic pain and pain itself is so complex, and there's still so much we don't even really understand about certain things. I think that does put, unfortunately, a lot of pet parents in this position where it's like, we can suspect it, we might never find the answer, or it might take us a long time. I think it's interesting that she responds to like an NSAID, so an anti-inflammatory, that again can give us some ideas of what is hurting within the body, because gabapentin is more of like a nerve pain, right? A kind of component that we would expect for pain management. So sometimes too, like those pain med trials can be actually helpful in identifying like what type of pain might be happening, but it's also not always going to easily identify everything.
Excellent. Let's see, Grace, any tips for determining whether your dog is experiencing dental pain? Just low appetite? Anything to look for in the mouth, the teeth, the gums, etc.?
Yeah, dental pain is a huge issue. It is really just not diagnosed as easily as we would expect. So a lot of dogs can have very decent looking mouths, and when you actually go in and see what's going on with x-rays, really challenging. So I always say, like, if we have dogs who don't enjoy having their mouths opened by the vet, you can like toss treats and quickly take like a video or a picture can kind of help us like look inside their mouth a little bit. But we can see certainly lack of appetite, inhaling food, chewing on one side of their mouth, particularly. Sometimes conflict around food and appetite absolutely would be some markers for me. Bad breath can be a marker of dental health and dental issues. I'll even see sometimes dogs who are often like pay a lot of attention to their face or paw at their face, or sometimes even digging a lot. And I mean like abnormal digging, like at carpets and rugs and things like that. So those can all be associated with dental distress. It is incredibly rare for a dog to stop eating because their mouth hurts. The pain has to be completely unbearable for that. So I think too along those lines is regular teeth cleanings are advised. I know they can be very expensive, but they'll take x-rays so they can actually see if anything's going on. I had a friend who she saw a spot on one of her dog's tooth. She was like, it's so small, but I'm convinced something's wrong. And so she had her dog go in for a dental, and they had to pull that tooth. So it is a lot more common. And I think dental care and even just checking in on dental care is something that a lot of pet guardians put off, understandably, because it's expensive and it's often stressful for the pets. But that is really your best chance of finding it.
Yeah, we were talking before we started the session about cats care at the vets, and I think that's teeth is something that's really common in cats, but very, very neglected.
Yes, and it's often, as my vet says, a genetic component. So I
Hmm.
have an 11-year-old cat, and he has beautiful teeth. They're gorgeous. And then my cat who's behind me now, she's only about 2, and we will be scheduling her dental cleaning this month. So our vet suggested it, and in my brain, I'm thinking, if we don't go in there and get x-rays and clean and be preventative and also see what is going on in her mouth, how will we know? We really won't, especially with cats. They're
Hmm.
super stoic.
Yeah, yeah. Any recommendations for how to deal with potential pain behavior issues in a shelter setting? What a great question, especially when there are limited resources and or if there's trouble getting buy-in for pain as a cause.
Yes, that is a really thoughtful and tricky question. As someone who started in sheltering and I have also done pain assessments for foster and shelter dogs before, I do sometimes worry it puts them at a disadvantage in terms of like health insurance covering certain things if we know about them. But of course, we don't want dogs to be painful, especially in an environment that is so emotionally stressful. I do think it's worth learning some basic signs of lameness and potential musculoskeletal or GI issues. Again, resources are going to vary depending on the shelter and the rescue, but pain trials can be really useful for those dogs. And I think that they're a bit more affordable and realistic. So, a pain trial is essentially putting a dog on a type of pain medication, usually for about 6 to 8 weeks, to see if it impacts anything. And I usually do not expect a dog to just suddenly stop doing the behavior, especially my shelter babies, because they're so stressed all the time. But we can look at like intensity, severity of behavior, frequency. We can kind of note like, are they settling easier? Those kinds of things. Are they responding to training? Um, Pain trials don't always give us accurate information. Again, if you put a dog on gabapentin, which tends to hit nerve discomfort, and they've got muscle discomfort, is it going to be the same? Like it's not going to hit. So it can still be complicated, but I think in that setting, I would really look into there is some good research on pain trials in dogs and how to accurately do them, not just 2 weeks and calling it. That would probably be my first thing in a shelter setting for a dog that we suspect discomfort in, as well as some adaptations. It's hard because sanitation wise, the floors are hard and slippery because we have to be able to clean them. So giving that dog a space where maybe we can put a yoga mat down and just let it live with that dog until the dog leaves, or giving them office space for a little bit if possible, to just give their body a break from having to navigate those flooring could be helpful for them as well.
Yeah. Let's see. Okay, they keep popping in every once in a while here. So how important is it to identify the problem if the medication that you're using is helping with the symptoms?
I think that is a question for you and the vet to discuss for sure. And I would say like a specialist vet who is like helping you with pain management. Um, Personally, we know that multi-module pain management approaches are the most effective. So that means doing a couple of different things that we combine to help reduce pain. So like that includes putting carpet down in your house, right? Um, Lowering the amount they have to jump, or we would baby gate our stairs so my dog didn't have to go up and down the stairs multiple times a day, right? So those are quite effective. But things like PT are super, super effective for long-term movement health. Even some of the treatments like the laser therapy, hydrotherapy, all those things can be really, really helpful at if we've got chronic conditions that need help maintaining strength in our dogs. And the issue is if we don't know what's going on or where things are going on, it makes doing those things harder because you're not going to do certain PT exercises if your dog is struggling on their front end versus their hind, right? So it can complicate the, I would say, like the detailed care we can give them. And there might be more we could be doing to help them kind of navigate their pain management. So for me personally, I'm a big fan of like, yes, I want immediate pain relief if we can provide that for any dog, but I want to know what's going on so that I can accurately make decisions about their care. So keeping in mind that again, sometimes we can't find the answers or the answers are really hard to find and we're doing the best we can with what we've got, right?
If anybody has more questions, pop them in there. But in the meantime, I'm going to ask a question. Um, so I'm just going to kind of give a little quick little summary. Worked with a client with a puppy. They got it at 8 weeks, Cocker Spaniel. Came to them with Giardia. I started working with them at about 10 weeks old because the dog was highly aggressive, highly resource guarding, etc. The dog had chronic Giardia, finally tested negative at about 10 months old. It would wake when it was little, it would sleep, and they had younger kids who obviously they're adorable Cocker Spaniel they wanted to hold and pet and sit by and all those wonderful things that they were expecting. And they ended up with this puppy that it would lay down next to them or they would scoot over while puppy was sleeping and she would wake up and kind of startle awake and look back at her side and then attack whoever was next to her. And so we really had to work through pet consent and you have to leave the dog alone. And it was very, I felt so bad for them. It was very difficult to work through. She finally, I believe, grew out of all of those behaviors at about 2.5, 2.5. But what do you recommend for people who the dog is supposedly cured, right, of the pain that they had, and the dog is still performing a behavior that it learned while it was in pain, right? Because even at a 1.5 years and she had been Giardia free for 6 months, was still waking and biting people sitting next to her. Is Dynamic Dog something that could help with that? What would you?
So I would be curious if that was the only thing going on with that dog. For one, is the Giardia discomfort escalating other discomfort or anxiety or things like that, right?
Mhm.
For sure. That would be a question I'd be interested in. I would definitely want to know if the dog had any postural or gait abnormalities. And some are much more obvious for people. Now that we offer two different types of pain assessments right now. One is a lot more detailed. The other is just I will often say, can you just send me a video or a picture and I'll let you know which one I think you might need based on the behaviors and also the way your dog looks. Because if I look at a dog and I'm like, oof, you look really painful, then it's gonna tell me that we really need to, we probably don't need as much detail, right? We're like, oh, there's a lot going on. And it's very obvious. So I would be curious to look at that dog. I think it again goes over that question of have we actually investigated all the potential options. The same way we would investigate behavior modification wise, like the types, when is the behavior happening, all of those things. It's very similar to me. So I do think that if I have a dog still performing those behaviors, I'm going to make sure one, do we think there is still something going on that was heightened by the Giardia? We do also have dogs who it is a learned, the anticipation of pain is enough to kind of learn that they need to protect themselves. But I would expect those behaviors to improve with things like counter conditioning, right? I have a client right now where we're actively investigating pain and having a training plan. And I'm like, we are not going to actively start counter conditioning this dog to touch and handling until we've sent your pain report to the vet because we might make it worse, right? We can't train away the discomfort they're feeling or the potential that they think they're going to feel discomfort. So it it can be hard to know, but again, in those cases, I'm like, if you hit so many boxes. The resource guarding, the startle behavior, like all those things, absolutely. Any handling sensitivity, especially when I have a lot of clients who've had their dogs as puppies, and I'm like, so what was your training like as puppies? And they had great training. They went to puppy classes, they had R plus trainer parents, right? So not that those things can't change, right? They're not fixed just because we do everything quote unquote right. Doesn't mean that it's going to be perfect. But the expectation I have might be different of a dog who we practiced handling this way, or, were the kids always waking up puppy and then these behaviors developed? Like those are the kinds of questions I would ask for sure.
Yeah, yeah. This one was difficult because
Yeah.
I saw them last time I saw them for training was at about 18 months old. Things were going well because they had learned we'd gone through cooperative care, cooperative handling, pet consent, all of those, safe space to sleep, all of those things. And then I saw them again when the dog was about 3, and she was fabulous. They had no trouble. But in the end, it's a question of, did the pain go away, or did the things that we did,
Yeah.
prov make her feel safe enough that she wasn't doing it anymore? It's interesting. That's one of those questions of, do you ever get a diagnosis?
And sometimes with cases like that, I did have a friend when I was at the shelter who she just, when I was doing behavior, she was just like, I feel like every time we kind of resolve something, right? Not really resolve, but we ended up managing it. We do some training around it, and my dog is like, okay, cool, yeah, something new takes its place. And so I would expect a dog who's remaining painful. Like, I mean, it also is very personal, like, same with people. Some dogs can be very painful and they're like happy-go-lucky dogs and like they navigate chronic pain better and it doesn't impact their emotions as much. And all of that does make a difference too. But I always kind of say, like, I would expect if my dog were still painful, we'd see other things on like kind of popping up in the place. So we might do much better with leash activity, but now noise sensitivity is rolling in, right? So I I would be curious for sure. We never know for sure, right? But absolutely, I would guess that the discomfort of having Giardia constantly, and probably the process of treating the Giardia, made them extra sensitive for sure.
Yeah. All right. I think that's the last of the questions. This was fabulous, Kat.
Thank you
Um,
guys so much.
Thank you so much for presenting this. Thanks to everybody who joined us today. If you would like to donate to Your Dog's Friend, you can go to yourdogsfriend.org and click on the donate button. I encourage you to check out our online resources at Your Dog's Friend and subscribe to the YouTube channel. There's tons and tons of webinars. So that's going to conclude our webinar for today. Kat, again, thank you so much for taking your time to do such a fantastic, detailed webinar today.
Thank you guys. I appreciate you inviting me.
Thanks. Have a good day.